Welcome to ClearMind Integrative Health Onboarding Series. Dr. Duhan, tell me a little bit what inspired you to start down the path of the metabolic approach to cancer.
Well, The Metabolic Approach to Cancer is actually a book written by my mentor, Dr. Naisha Winters.
And we do require our patients to read that.
I do. I have that in the treatment plan. When people see me for the first time, I talk to them about the metabolic approach to cancer and I ask them to read it. Because when you read the book, you will understand how I work with you. You understand what I'm doing. You understand a little bit more about how my approach. So I base my approach when I work with oncology patients on that metabolic approach. And that is what we do here at ClearMind.
So, through that personalized way of looking at things, like you talked about, you do some pretty extensive labs.
Right. We go a little bit above what normal lab testing is. Like the normal lab testing, you will see most doctors running typically are CBC CMPs, maybe a couple of extras. We're running a comprehensive panel, which has been designed or kind of developed by Dr. Winters. And we use that as what we call our foundational testing because it's comprehensive, meaning it looks at several areas in the body. So when I see people's comprehensive labs, I am able to glean quite a bit of information from that. And it helps me to start to see patterns emerging. What kind of pattern, metabolic or terrain pattern I'm working with.
So, with that, you're not treating, if someone comes in with breast cancer, you don't just treat breast cancer as a common theme.
No, we don't treat cancer. So I want to make that very clear. What I do work in is we are terrain centric. So the tumor is worked with by your oncologist. Everybody has an oncologist and they specialize in that. That's what they do. And that's what they're on the team for. What I work in and what I specialize in is everything else, is what's going on in the environment around that tumor.
So when you spend time with people, like you talked about, you're spending an hour with them, you're not going down the list of check, check, check.
No, because the checklist is about me treating a symptom. I'm not going to treat the symptom. I want to find what's the driver in the case, what's driving this chronic condition. And when we find that, that's what we work on. And we use labs, that data to tell me, are you on? Are you off? It's data that lets me know. It's biofeedback from the body. I say that a lot. It's feedback from the body. Am I in the right area or not?
So in your practice, as people move through their treatment plan, you're testing that same comprehensive lab several times.
Right. So we usually do comprehensive labs once every 3 months. We may do monthly labs, which is a different set of labs, just to kind of see, like, we may want to test what we're treating, what we're working on, what area we may be working on. So we want to see if our treatment is working. I am data driven. I don't talk to people without information because, vitamin C, it may be good for you. It may not be good for you. It may be a timing issue, right? A lot of people come to me like, is vitamin C good for cancer? Well, it depends. It depends on the data that we're seeing. And is it time for that? So that's what I use, the data. That's what we use, the comprehensive labs. That's what we use all labs, and maybe just regular blood labs or monthly labs, or maybe a specialty lab. But that's what we're doing when we look at that, to see how is it informing our treatment? How is our treatment plan doing? Are things changing and moving in the direction we want it to move into?
So trends and patterns for you are more than just a snapshot in time.
Right. Yes, because trends develop over time. So that's one thing that I like to look at, is I like to see trends. The trends don't really come forward until we've worked with the patient maybe 3, 4, 6 months. Then we can start to see the patterns, because everybody has a pattern. Their blood, we can see it. And then when we see things deviating from that pattern, then we know something's up, and we can catch things before the house is on fire. You don't have to wait till something's on fire before you do something about it. We want to catch that way before, because sometimes fires, they destroy, right? So we want to make sure that we're dealing with things as we're recognizing them in whatever lab we're doing.
So as we're talking about labs, you do quite a comprehensive lab panel, as we just talked about, but there are certain things that sometimes never get tested.
Right. Yes. So we test things like insulin, fasting insulin. We'll test A1C. We'll test high sensitive CRP, which most people don't know what that is, but it's a marker of inflammation. What I'm choosing as part of the testing is not random, it's very strategic. Because what the tests show me it will elicit is that pattern present. Am I seeing that inflammatory pattern, for instance, right, through the CRP? And CRP, if you really want to understand that, is tracking. And you can look on PubMed or any really good, credible research site and punch in CRP and cancer, and you will get tons of papers written on CRP as showing progression in cancer care, CRP showing recurrence in cancer care, CRP showing stabilization in cancer treatment, I should say.
One of the things that I think is really powerful that you do with people and the time you spend with them is they start to understand these patterns themselves.
Right. So my hope and what I want the patient to understand is that when they get their labs, they're not destroyed by their labs, but that they can recognize the patterns themselves. Some of the patients that have been with me for years can do that. When they get their labs, they can tell me what's going on and what they think is going on, which I appreciate that. That means that I've taught them and empowered them to where they can look at their labs and know, okay, I think something's wrong with my metabolism. And they show that to me, and I'm like, well, you're right. Let's come up with a plan to help repair that.
So I think sometimes what happens is people get afraid. We call it scanxiety or labxiety, right? We're afraid to look at that. But really, what I'm hearing you say is that knowledge reduces fear.
Right. They always say knowledge is power, but
Yeah.
that's true. If you have the knowledge, then you have the power to change it. And that's what we want. I think a lot of disease does to people is it renders them helpless. And we don't want to render you or make you helpless. We want you empowered because you need to walk forward. You can't walk forward feeling helpless.
I think that's a great way to end this video, that knowledge reduces fear and it helps you empower your healing.